of people make a distinction between Western medicine, pharmacology, psychiatry, internal medicine, and Eastern medicine, energy work, meditation, prayer. Do you make a distinction, either intellectually or in your practice?
I learned to not to. Of course, when you go to medical school, it's a completely different. What was great for me, because I came from a very different background, and then I go to medical school, and that opened up my mind for completely what we call Western medicine. And but Western medicine was developed mainly based on treat illness, and help the person and treat the person, but thinking about how to cure or treat that illness. When you see the Eastern philosophy, it came, and even the Eastern medicine comes from a very different approach. They come from more an approach is how to help this person, and not that disease or what's going on with them at that time.
You alluded to the butterfly approach, and I'm seeing a connection between the crossover between Eastern philosophies and Western medicine in that. Can you say more about the butterfly approach that you use in your practice and the origin of that?
Yes. Basically, on the butterfly approach, we have the two sides, what we call metaphysical and physical sides. The metaphysical side would be represented by mind and also spirituality, and the physical side is the body, brain, and environment. The idea of the butterfly approach is because the butterfly has 4 wings, and every wing I put one of the levels. But what the main importance is, all this gets together because we are human beings, and we are the connections of these two worlds. That I feel that there are two worlds that in reality are one, but for human beings, for us at this moment in our evolution, we see as two worlds, metaphysical and physical. But the integration and see them as one, I think is our challenge, but also what make us grow, and is so important when you think about all what can happen when you start thinking about one, the Eastern and the Western together. And this idea about integrate everything, and what I call is put 1 plus 1 plus 1 plus 1 equal 1. I mean, like you have 4 different parts, how that can be seen as one.
How do you use the butterfly approach when you work with patients? How do you help them experience the 4 different levels, the 4 different aspects of themselves as unified?
Yeah, I do when I see a patient, someone that is asking for help, with someone with depression, for example. I try to educate people, because I find that knowledge is very important. And more knowledge is someone has, their chances to deal with their illness will be better. That means I try to convey them the importance of taking medicine to improve their brain, but also to convey them the importance to do psychotherapy, for example, for depression, to learn how to apply their mind in a more positive way, in a way that they will achieve their goals more. And I tell them that if we are able to improve those two sides, they will be able to notice that their relationship with the world, with their environment, is going to be different. And this relationship is 2 ways. The person is is receiving and there's an intake of a lot of information and food, minerals, drugs, medicine, everything. But also we put a lot of energy out there. That means it's a two-way relationship. And also I try to convey to them the other level that is the spirituality, how important that level is on our lives. Because I feel that that level is very much related with the feeling of hope and the having hope, bring hope is so important. There are so much research showing that someone that feels more hopeful about any kind of treatment, how they are dealing with their illness, they do much better. That means this is how you see in some ways the spirituality in action, is how you see the results of having hope.
Mm.
Yeah.
That sounds like a very egalitarian approach to healing people, instead of the doctor being the gatekeeper and there's only health and well-being through this professional.
Mm-hmm.
You're helping your patients to see how they can achieve better health in ways that they have more control over. You know, spirituality is very personal.